name's Kate Anderson. I wanted to share some tips about sleeping while being pregnant. At 20 weeks and beyond, typically we suggest sleeping on your side, left side. You can alternate to the right side unless there's a medical reason that you've been told not to roll over to both sides. But usually we start on the left side. It can help digestion. Your stomach's a little lower, right? Then your heart, then your throat. Sometimes it helps reduce heartburn, but can just help you digest your food in general. And then, of course, keep baby's weight off of the right side of the pelvis, the vena cava, which is what we're avoiding by laying completely flat on our backs beyond 20 weeks. Now, I've taught prenatal yoga about 5 years, and I have had 2 pregnancies now. I'm in my second, and I have experienced that sharp hip pain on the sides while sleeping, during the day. I've been on the roller coaster with you if you're there. So I have tips that have helped me a lot, that my students have given me, that I've tested out, and I just want to share them because sometimes I can't get to everything in a yoga class. So first, I would say this one sounds a little weird. I've had people tell me they didn't believe it, didn't think it would help, and then they tried it and it helped. Sometimes it's our posture, laying on the side of our body in the bed. Your hips sink down kind of deep into the bed. Also, there's hormones affecting that the joints are loose, right? That relaxin hormone. So it's not just your bed, your pillows. It can be hormonal too. But if you sink in a little bit, sometimes the hips are lower than the spine. We're just out of alignment with the spine and the pelvis. So you can fold a blanket, okay? You can take a blanket at home, any kind of blanket. I've tried fuzzy, like fleece blankets, and you could fold it up as many times as it's comfortable. Maybe you're folding it up small, depends what kind of blanket it is. Maybe it's even a little bit lower. I've had people tell me they use eggshells, like a mattress cover, or even towels, that has helped immediately reduce hip pain, and I've experienced this too. So you would fold up the blanket, take it right under your hip, do this at night before you're settling into bed, and then you'll lay down. So it's just gonna lift the pelvis up a little bit, and hopefully bring the hips more into alignment and reduce pain. I would say try different blankets, different towels. If the first night it's not working, try folding it lower, folding it higher, that kind of thing. The other suggestion I have is getting a bolster. Pillows, that works too, between the knees and the feet. So when you are side lying and sleeping, especially for a long period of time, just between the knees and having your feet down can pull on the hips, can cause pain. So try to get that pillow between the knees and the feet, and it's about that same distance between the knees and the feet. Also play around with pillows. If you just have one thin pillow, you might still be a little low with the knee, and that can pull your hips forward or just not feel as supportive, okay? So honestly, myself right now, 26 weeks pregnant, I'm using 2 pillows. I kind of have a long thin one and then a memory foam pillow, and with the 2 together and having support underneath and supporting my belly, I find I don't have hip pain right now. But I know it's always a roller coaster. You kind of always have to try different pillows and try like a different setup. The other suggestion I have is you can roll a little bit on or off that hip bone. If the hip bone is just uncomfortable, pushing down, there's just too much, whatever hip is down, too much like weight on it. What we can do is sometimes, and a little higher up can be helpful, like multiple pillows, but sometimes we can just have one leg up and that feels good, and you just scoot a little bit off of that hip bone, a little forward, no compression on belly, lots of space for baby. Or some people like putting a little pillow behind them so they can roll back slightly, be off the hip bone a little bit, but you're not laying on your back, right? You're still on your side. So that might look like a pillow behind you and maybe, something still between the legs here. Okay, I'm gonna give another suggestion, which is to buy a wedge. And again, I say this because I've experienced it in both of my pregnancies. If I even travel, I traveled recently, second trimester just started, I took this with me. I mean, it's my lifeline. So you can see it's a wedge. This one is by Boppy, memory foam type, but I know there's tons of brands out there. Even if you get a massage and you go to a massage, you can take it with you, do it, have it as an option for side lying, okay? So all these things stay, maybe a little blanket under your hip, maybe lots of pillows between your knees and feet, and then this wedge comes right under your belly, right under baby, just like that. And again, it just helps posture. It's gonna help your low back pain. It's gonna help the lumbar curve, the low back curve from sinking down so much, help the pelvic alignment, okay? So that's an option, right? And you can always adjust it a little lower, a little higher, a little further out. And you might not need all of these things, but maybe you're trying different options. You know, I say sometimes it's a roller coaster. You try a few things and then you have to mix it up, try something else. The other thing I wanted to show is this brand Baby Bub, which is really popular right now. I don't work for them or anything, I don't get commission from them, but someone gifted it to me and I absolutely love it. Sleep with it every night right now. So you get a wedge in the front, a wedge in the back. It's adjustable, so you can take the Velcro, make it closer, make it further away. So basically, I'm sleeping, still have the pillows between my knees, but I have a little wedge behind and a little wedge in front. It can help you from rolling over, but again, I think it helps reduce back pain. I think it just helps give a lot of extra support to the front and the back. It does come with another small pillow that you can kind of wedge behind you. And there is an option if you go with Baby Bub. They sell something like a bolster that's kind of this shape, okay? So it's kind of this shape, and then you have, right, lots of things you can play with. You have the wedges, you have a memory foam type bolster. Again, I don't work for these companies, I just love that these pillows have helped me. So any kind of wedge pillows can help you. The last thing I'll say, you know, as you're playing around with pillows, sometimes that pregnancy pillow is really popular that's like a big U, okay? And I just want you to play around with flipping it sometimes. So you may get different pictures when you buy them or someone gave it to you, you don't have pictures, and it can go over or under your head, come around your front, and then it's a U, so it goes around the back as well. And you can play with, you know, getting it under your bump, getting it between your knees. Watch the feet. We want something between the feet as well. But some people like flipping it. So you still have your regular pillow or two for your head, for your hands, right? And then the U is this way. So it can go between, under the belly a little bit, between the legs, the feet. You have extra cushion to go between the feet. And then it goes behind you and you can kind of tuck it to your low back. So that's just my advice, that remember, if you did get the big pregnancy pillow, don't give up on it. You know, if it doesn't help you the first night, you can flip it. The part for the head could go to the feet. Okay, trying to think if I have any last minute tips. But yeah, always happy to share these things. Every once in a while, there is a student that I meet that needs to recline to sleep at 45 degrees. So we would say, don't sleep flat on your back, sleep at 45 degrees. And at that point, I would say, get permission from your provider, right? Because we don't want to sleep at a 45-degree angle every single night unless your doctor has told you that's okay for you and your body. It doesn't put baby in the best position for third trimester, kind of can put them closer to your spine, but also we have to sleep. So some people sleep in a recliner, some people get a wedge and are lifted up, but check with your doctor first. You gotta make sure you're doing it really safely. And we do this in Shavasana in yoga too, where it can be, you see the bolster underneath and the block, but it could be 2 blocks underneath. And then you get close to it and you lay back and you can see I'm more at that 45-degree angle. I'm not laying completely flat. Knees could be bent, legs could come out. You also could put a cushion under your knees, a nice pillow under your knees. So you kind of have to check with your doctor. You have to make sure it's 45-degree angle. And then when you're coming up, try to slowly roll to your side and come up. But yeah, hope those suggestions are helpful. Share this video as much as you want. Like I said, I'm a prenatal yoga teacher. My name is Kate Anderson. I'm also a birth doula. So if you want to reach out and have questions, it's meditatewithkateanderson@gmail.com. All right, thanks. Have a good day.